My name is Dr. Nicholas Ngwili. I'm a postdoctoral scientist at the International Livestock Research Institute.
Hi, I'm Dr. Matthew Dixon-Zegeye. I'm a Senior Research and Innovation Advisor at Unlimit Health.
SUSTAIN is short for Sustainable Strategies for Tinea Solium Interventions in Northern Uganda, and is basically a project which we aim to control the pork tapeworm by treating people and pigs at the same time.
Pork tapeworm is a zoonotic neglected tropical disease. It infects both pigs and also humans. So when humans are infected with the adult tapeworm, they get an infection called humantiasis, and when they're infected with the larval stage, they get an infection of the central nervous system called neurocysticercosis. Pork tapeworm is the leading preventable cause of epilepsy in low and middle income countries where tapeworm is endemic. It's accountable for approximately a third of epilepsy cases in these settings.
Epilepsy is associated with a lot of stigma and also loss of productivity. Therefore, if we control this parasite, then we hope to improve the health of people and their productivity, and also the economic gains, because then we have healthy pigs which fetch good prices. SUSTAIN is a collaborative project, and most importantly, we are working with the Ministry of Health and the Ministry of Livestock Development in Uganda. I think one of the innovative way we approach this is we started with first understanding the context, really trying to study the value chain, the pig value chain in northern Uganda, and also doing other studies to really understand the socioeconomic aspect, the knowledge, awareness.
Within the SUSTAIN project itself, we'll be tackling the pork tapeworm through a One Health strategy, which integrating two components in the animal and human side, and very much involving the different ministries in tackling this problem.
Specifically in designing this intervention, we involved local communities in the design. What is the most important intervention to them? We are also working closely with them to really understand whether this project will be feasible, how will we measure the outcomes.
One of the major parts of the project is modelling work. We support initially through dynamic transmission modelling to essentially look at the longer term impact of the intervention beyond the end of the trial with our transmission model. One tool we're hoping to develop is a toolkit that the national government will be able to use to then look at simulating the interventions in other parts of Uganda if there's interest in scaling up the SUSTAIN project.
We hope to really see reduction in the burden, prevalence of epilepsy related to the pork tapeworm going down. And also, it would be nice to see farmers producing a safe pork and being profitable.
And at a policy level, we really hope to bring together the different sectors and actors under this One Health umbrella and really look to tackle the pork tapeworm problem from this multi-sectoral lens.
And we are also working with local universities, Makerere University and Gulu University.
So we have the International Livestock Research Institute, ILRI, and Unlimit Health involved at the international level, but also from the UK we have Edinburgh University and Imperial College London. The funders, the UK's Medical Research Council, and also the Foreign Commonwealth and Development Office.
We started working on this parasite some years ago, and particularly for northern Uganda from 2022. People were aware of the problem, but they couldn't tell like it's a bad disease. So seeing over the years the improvement in awareness, even as we moved to try out other interventions, I think that's a huge motivation for me.
Combining interventions between the sectors can make options for policymakers more cost effective and more effective is really important, and the Sustain project will strive towards that.
So we are just in the starting stages, and I think we'll keep sending updates through the Unlimit Health website, the University of Edinburgh, and of course the International Livestock Research Institute.